Hi, Dr. Dave Webster. Again, in one of my continuing series of videos on the state of healthcare in Ontario. This particular one is directed at Cancer Care Ontario. It's one of the Ministry of Health committees or groups or bureaucracies that of recent has taken over the role of handling the further introduction of PET scanning in Ontario. This was originally done by the PET Steering Committee. The PET Steering Committee, as far as I know, still exists and will be part of this, but it will be coordinated through Cancer Care Ontario. And I believe they're handling all aspects of PET, not just the oncological uses or cancer uses. There are many other uses of PET, particularly in dementia, which patients won't remotely have access to, and also the cardiac, which gives us better and cheaper tests and better tests and so on than we currently have with normal isotopes we use in nuclear medicine, but again, very unlikely to be widely available in Ontario, which is tragic because we actually have one of the world experts in cardiac nuclear medicine based in Ottawa, Dr. Beanlands. But this letter, or this video, is really to Dr. Julian Dobranowski, who has taken over this position at Cancer Care Ontario. Dr. Dobranowski is a radiologist, and he's from McMaster University. And please note that most of the key people that are in charge of these various committees that are involved with your healthcare in Ontario are from McMaster University, which really, McMaster, I think, sort of considers itself the epicenter of the universe when it comes to evidence-based medicine, and it is evidence-based medicine that is in question here, because they're using this to, establish the role of PET and many other things. And again, the point of my website is PET's just a great example, but it's about healthcare decisions in Ontario. So Dr. Dobranowski, shortly after taking this position, he gave a talk at a meeting in Toronto of doctors and various people representing Cancer Care Ontario, and it was after his talk that Dr. Dreger actually finally got up and, in complete and utter disgust, resigned from the PET Steering Committee, its most senior member, and resigned and made that astounding statement that he believed that what those who were blocking PET in Ontario were doing bordered on immoral. Anyways, Dr. Dobranowski, after he came off the stage, went over and I said, look, Dr. Dobranowski, please, I've been trying to, nobody will answer these questions. Could you answer a couple of questions for me? I said, first and foremost, this evidence-based medicine tool that you're using, this health technology assessment tool, has it ever actually been rigorously scientifically validated to be used for what you're using it for, and that is to evaluate a diagnostic piece of imaging equipment? And he basically mumbled and said no. Fine, and I said, so did you tell the patients and the ethics committees that this is a non-validated tool you're evaluating these people with? And then I said, but wait a minute. I said, let me ask you this. I said, PET really isn't what you're testing here, is it? What you're really trying to do is validate the research tool. You're trying to validate the health technology assessment tool, the evidence-based medicine tool. That's really what the experiment's about, isn't it? PET really isn't what you're testing here. You're just using that as something to help you, validate your tool. And I took from his shrug of his shoulders and so on that he agreed with that. He certainly didn't say, no, that's not the case. And again, I said, did you tell the ethics boards and the patients? So fine. I left it at that. That was November. So in the following June, when I started working on this website, I wrote Dr. Dobranowski a formal letter, told him I'd be launching his website, and I expected Cancer Care Ontario to take some position on this. And I just, as part of that letter, I just asked a couple of very basic questions, including, for example, the qualifications of the people that were writing the general nuclear medicine research studies. It's not clear just how much training and experience they've had, and so on. What did they publish? Been invited to publish any textbooks or speak as experts at any international meetings? I'm not aware if they have, and so on. But then I asked him, please, this is what you said to me. I want this to be stated publicly. And so I sent him the letter and asked him these questions. Was the health technology assessment tool rigorously validated to be used for looking at any piece of diagnostic equipment? Was the purpose of the experiments really to do the HTA? And he wrote me back in August, and as has been my experience with all of the people I've been dealing with through the Ministry of Health and the various experts I've written and the politicians, they simply refused to answer the question. The only thing Dr. Dobranowski would confirm is that, in fact, Cancer Care Ontario, it is their intent to continue to use this evidence-based medicine tool. Wouldn't even answer a question as basic as what are the qualifications of people that are making these decisions. So I will now be drafting a letter back to Dr. Dobranowski. All these letters, his response, and so on will all be on my website for you to view. And I have no choice but to assume that what I took him to say and support were in fact true. There is no evidence that the evidence-based medicine tool they're using has been validated for the use they're using, but they are really just experimenting and trying to validate the tool and not really telling anybody this, it would seem. The patients don't, I suspect, aren't informed of this, and I'm not so sure, and I doubt the ethics boards are this as well. So in this particular video, I'm asking Dr. Dobranowski, please, on behalf of Cancer Care Ontario, please, one question, simple question. Why would Cancer Care Ontario support the use of a non-validated research analysis tool that, as you know, has taken Ontario cancer patients to what is considered effectively a third world culture? They have the most restricted access, to modern diagnostic imaging in cancer in the world. Why would Cancer Care Ontario support the use of that tool? And when you're constructing your answer here to this, and I would strongly urge you to answer this question on behalf of Cancer Care Ontario. I mean, it's a publicly funded and supposedly open and transparent democracy we're living in here. I would ask that you use the breast PET trial as an exemplary, or as an example of just why Cancer Care Ontario would support the application of this process. I mean, there could be no better trial, I guess, than to demonstrate exactly why it is important that the government of Ontario evaluate PET. I mean, it's funny they don't evaluate any other imaging technology like CT or MR, which people are beginning to question, and using PET sort of to direct whether or not these are actually necessary. That's what's happening in the rest of the world. But do that. Please explain, using the breast cancer trial, why Cancer Care Ontario is supporting the use of a tool which is not validated scientifically. And for those watching the video, the information is all there, and the contact information for Cancer Care Ontario is there. I would strongly urge you, do not let up until you get satisfactory answers to understand why. Surely you deserve to know why we're last place. There may be for good reasons, but it does beg the question, because yet again, why are these experts, they're claiming they're doing groundbreaking, world-class science, that everybody else should be looking to them to find out the proper way to introduce PET. The rest of them, I must assume, the Liberal government Ministry of Health people must assume that the rest of the people in the world have bought snake oil. Effectively, you must be laughing at them. They're using PET for all these silly indications that the Ontario government experts know just aren't useful because, well, they've used evidence-based medicine to show that. Anyway, again, I'd encourage you to demand, and use the power of the internet to speak as one voice, a huge voice, and finally, maybe get someone to stand up and explain why. Thanks.